and welcome to part 2 of our notes on skin and the integumentary system. In this section of the notes, we'll cover skin coloration and skin cancers. So let's take a look at skin color first. Three pigments contribute to skin color. Melanin, which is the one that produces the reddish brown to black pigments, yellowish, is responsible for the darker skin tones. If you have a concentration of them, it'll cause freckles or pigmented moles. Keratin with a C, not keratin with a K, like we talked about in the last section, which is the protein in your epidermal cells near the top in the stratum corneum, but keratin with a C, like carrots. And it has colors like carrots. Yellow and orangish pigments, generally most obvious in the palms of the hands and the soles of the feet. Some people see it a little more clearly in themselves than in others, but if you look closely at the palms of your hands, soles of your feet, they're going to be a little bit more yellowish in color than the rest of your skin. And lastly, hemoglobin. Hemoglobin is that protein that carries oxygen in blood, and it is red when it's oxygen. Well, it's always red, but it's different tones of red depending on how well oxygenated it is. And it's responsible for the pinkish hue of the skin. So you got more blood going to near the surface, and less other coloration covering it up, your skin's going to look pinker. If you're more tanned, you have more melanin, you won't look as pink. So there are some different skin color diagnoses or colors that will lead us to think that, oh, this person might have this issue or that issue based on some skin coloration issues. So let's take a look at a few just on the surface level here. We're not going deep. This isn't med school. Cyanosis. This is blue tinged skin. You get blue lips and blue fingernails. This is generally due to deoxygenated blood. Just want to be clear. Deoxygenated blood is not blue. Your blood is always red. It'll be a brighter red when it's oxygenated and a darker, duller red when it's deoxygenated, but it's always red. It's never blue. Okay, the bluish hue you get is due to the way that the light travels through the layers of the skin and the blood vessels and bounces off that and comes back out, and what light actually gets back out into your eyes is blue. Okay, it's not because the blood itself is blue. Redness. This is caused by blushing, fever, hypertension, inflammation, or allergies. Blushing, the blood vessels dilate on the surface of your skin. It's probably some sort of social signaling adaptation, to be honest with you. Fevers. When you have a fever, your body's trying to cool your body off, so it's going to dilate those blood vessels near the surface, like turn your skin into a radiator, so more blood at the surface so you can get more heat away from your body. So you're going to get reddish when you have a fever. Hypertension, high blood pressure. High blood pressure is going to force more blood through the vessels, even if you're trying to constrict them. More blood's going to get through because of the high pressure, so you'll look red there. Inflammation, your body's response to a localized infection is to, in part, we'll get into this later, it'll send a lot more blood to that area to try to increase the metabolism of your cells, get more white blood cells and phagocytes into the area to take care of the infection. And the end result is, as far as we're concerned in this unit, is to cause redness because you got more blood flowing into that area. And then allergies, like hives, are basically inflammation when you don't need inflammation, right? That's what an allergy is. An allergic reaction is your body's immune system responding to something when it really doesn't need to. Okay? Pallor, or being pale. It's not wearing a white shirt today. We're looking more pale. But that is kind of the opposite of redness. You got less blood going to the surface. This can be caused by stress, anemia, which would be a lack of, you're producing fewer red blood cells. Okay. Low blood pressure can cause this, and poor blood flow can cause this to different areas. Jaundice, it's yellowish skin colors. We'll talk more about that when we talk about the liver. But basically, your liver's not processing materials as well as it should, and we're getting toxins building up in the blood, which causes this yellowish color. And then bruises or hematomas. Um, this is when you have accumulations of blood that have gotten out of the blood vessels and are sitting in the tissue somewhere. And so those colors um, come from just excess blood in there. All right. Moving on to skin cancer. And this can be a difficult topic for some folks if you know somebody who's struggled with skin cancer in the past. So let me know if you're having troubles with this, and we can move around this. If you can't watch this, that's fine. But we do need to talk about it and the basics. We're not going to get super deep into oncology and skin cancer. I am no expert on it. We're just going to kind of talk about the basics and some of my the prognoses and the treatments. I'm sure I am behind the times on exactly what they do to treat various types of cancers, and it all depends on a whole lot of variables that we can't discuss in this class. But we do want to talk about it because it's an important part of the health of the skin. So most skin tumors are benign and do not metastasize. Do you guys know what it means to be benign and or metastasize? Yes. So benign is a cancer that stays in place and doesn't spread out. Okay, it's just a tumor, just a abnormal growth of cells that are growing out of control, but they stay in one place and aren't really causing too much of a problem. If it metastasizes, that's when the cells, these cancer cells that are replicating out of control, can break off from the original tumor and travel to other places and seed new tumors in new parts of the body. And that can be very difficult to treat. Because you're not just dealing with one tumor in one area, you're dealing with the potential for multiple tumors in multiple areas and getting into other systems that are even more critical. A crucial risk factor for non-melanoma skin cancers is the disabling of the p53 gene. And there's a whole bunch of risk factors, and there's a whole bunch of other genes that are involved. But just to give a basic understanding of what skin cancer does is you've got genes that control cell reproduction, right? Your cells need to be able to reproduce to heal, a cut or a tear. They got to be able to reproduce, make new cells to heal that cut. Um, Sometimes those genes that regulate that process, that cell reproduction process, um, get out of whack. Okay, and so you always have two alleles for every gene, right? You got one you got from your mom and one you got from your dad. Two alleles for every gene. Most folks, both those alleles for controlling cell growth are perfectly good. Okay, and so for you to get skin cancer or any cancer for that matter, depending what genes need to get messed up, one of those would have to get knocked out by some carcinogen like UV radiation, smoking, asbestos, whatever. And then the other one would also have to get knocked out in the same cell. Okay. So that keeps your chances of getting cancer relatively low. Can it happen? Yeah, you can knock this one out and this one can get knocked out. If you have a history of cancer in your family, you may be unlucky enough to have one of them that you inherited from one parent or the other already be knocked out and not be perfectly functional. And then that greatly increases your chances of getting cancer because all you have to do is knock out the other one. Because you have a lot of cells that already are like this, as opposed to just a few cells that are like this. And one's down, it doesn't take as much to knock out the second one. Your chances increase, unfortunately. There are three major types of skin cancer that we'll talk about: basal cell carcinoma, squamous cell carcinoma, and melanoma. So you can see they're named after the type of cells that start to reproduce out of control. Let's take a look at basal cell first. It is the most common skin cancer, and luckily, I guess, the least likely to become malignant. Okay, so it's more likely to stay in place. It arises, as the name implies, in the basal cells or the stratum germinatium, and proliferates and invades the dermis and hypodermis. So it kind of just grows out from there, often down into the dermis and hypodermis. Okay, so the surface looks more skin-ish, regular skin-ish. It'll be a bump, but it won't be, unless it gets really big, it'll still look like healthy skin. It's relatively slow growing. Because of that, it's unlikely to metastasize, and it's also more likely to get caught before it can metastasize. And in most cases, you can cure it with just cutting it out. This is the kind of thing people do all the time, and the older you get, the more of these tend to pop up. You go to the doctor, we'll say, yeah, that might be a basal cell carcinoma. They'll do a little, almost looks like a hole punch, pull that little piece of skin out. It's done. They send it off to be tested to make sure it is what they think it is, and everything comes back out fine. You're good to go. Some images of what they look like. Here's one there. You see it's a bump, circular in shape because it's growing out from that original cell that mutated, but it's generally growing down, so it still looks like skin on top. This one's a bit bigger, so it's getting a little more disturbed on top because it's harder getting nutrients and things and producing the cells properly. This last one, really kind of nasty looking, really big. This person obviously did not have access to medical care for a long time. This is the person's eye here. This is their hairline here. So it's this part right here. And it looks nasty because it is. And because the cells under here are not doing what they're supposed to be doing. They're cancerous now. And it's so big that it doesn't grow in from the sides anymore. All right. The next type of skin cancer, moving up in speed of growth and danger, are squamous cell carcinomas. And they arise from the stratum spinosum, where the cells start to become more squamous in shape. They arrive most often on the scalp, in the ears, and then on the lower lip. Can you think why it might be very often on the scalp and the ears? Yeah, UV exposure, right? We're out in the sun all day, especially somebody like me who doesn't have hair covering their ears or their scalp. If I don't wear a cap, I'm at pretty high risk of getting burned here a lot. And the more often I get burned and the more sun exposure that gets, the more likely I'm going to knock out those genes and get some cancerous squamous cell there. How about on the lower lip? That's not really exposed to UV radiation much. What do you think? Yeah, I know somebody who's a doctor who, when he was younger, worked in the construction biz to pay for school. And a lot of people in that business were chewing tobacco, and he got addicted to chewing tobacco. And he kind of keep it under here and under your lip, and that stuff's nasty. They actually will put little fiberglass shards in there to cut up your lips so that nicotine gets in there better. But it's a big problem, and it's one of the bigger reasons why you tend to see this type of cancer on the lower lip. Any smoking can cause cancers around the lip because you're putting carcinogens in there, but chewing tobacco in particular is more likely to cause lower lip issues. It tends to grow rapidly, especially compared to basal cell. And if you don't get it out soon enough, it's much more likely to metastasize or start to spread, little bits of it breaking off and moving to other parts of your skin or other tissues in your body. And the more of it that spreads, the harder it is to get rid of. Prognosis is good if you can get it out and you're treating with radiation or whatever treatments they want. We're pretty good at getting rid of this one if we catch it soon enough. Just to kind of highlight the differences, basal cell and squamous cell. Basal cell, forms in a lower layer and tends to grow downwards. So when it's not too big, it tends to look just like a bump in normal skin, where squamous cells going to likely look a little bit scabbier a little bit sooner. Here's one. This color is just the ink line the doctor drew around it before surgery. Here's another one, a bit bigger on the back of that hand. Last one, melanoma. This is the roughest one. It's a cancer of the melanocytes, so those cells that produce melanin, that pigment that actually protects our cells from UV radiation. And it's the most dangerous type of skin cancer of the three because highly metastatic. And it's no surprise because of those melanocytes. We don't have a melanocyte in every single cell to produce melanin for every single cell that needs melanin, right? They're scattered throughout the stratum basal, and they produce this melanin, and they can move around and move that melanin around to get it into all the different cells. So they are already built with the ability to spread, right? So when they become cancerous, spreading is a real issue. So they're highly metastatic. They're harder to get rid of with treatments that we have as well. And there's an ABCD rule that we can use to help us identify if a skin cancer is a melanoma. I mean, obviously biopsies are the best, but to kind of give you a clue, A stands for asymmetry. They're not usually that nice, relatively round structure that we saw in the others, where you have one cell and it just kind of grows and grows and proliferates like a little bacterial colony almost and forms a circle. Because of their movement, they can get all sorts of weird shapes coming off the side, and that causes B, which is border irregularity. The border is not going to be a nice smooth round. It's going to be all jagged and weird looking. Because they produce melanin, color is an issue. They're going to have all sorts of different colors going on, not just looking like, you know, infected skin or scabby skin. They're actually going to have colors in the tissue. And then the last one, D, diameter. This isn't so much diagnostic as just a result of how fast they grow. If they say a diameter larger than 6 millimeters or the size of a pencil eraser, you know, so that, if it's bigger than that when you find it, it's more likely to be melanoma because it grows so fast that you may have missed it while it was still smaller. Whereas the other ones are a bit slower, so you're more likely to catch it when it is smaller, hopefully. But they do grow fast, which is why they say if it's bigger than the end of a pencil, it's a little more likely to be melanoma. How to get rid of it? You cut it out. Immunotherapy, radiation, chemotherapy. I'm not sure exactly which all they're using these days, and it's going to depend on exactly what type you have. If it gets too thick or too deep into the skin, the deeper it gets, the more likely it is to have metastasized and spread to other areas of the body, because it can get down into where it can get into blood vessels or lymph vessels, and then it's like a highway to get to other parts of the body, which is why the thicker it gets, the lower your chances of survival are. 4 millimeters is kind of that number. It doesn't mean if it's greater than 4 millimeters, you're not going to survive. It doesn't mean if you're less, you're going to survive. But the chances start getting worse at that level. Some pictures here. So here we can see definitely the coloration. It's definitely asymmetric. It's not a nice circle. And we have irregular borders on all of these. And this one here, you can see the diameter. These are quite large. And some other ones, just to see the different colors, the asymmetrical borders, the asymmetry. This one kind of looks like a panda bear. Here's the nose, the mouth, the eye, the ear, the neck. I don't know. And that does it for this part of our notes on skin. We looked at skin coloration and skin cancers. In the next part, we're going to look at the other two layers of the skin, the dermis and the hypodermis. So I'll see you next time. Have a good day, guys. Bye.